there's a lot of women in the area that have fallen victim to interpersonal relationship violence. And so we're able to screen for them, and if they are having trouble, we can help them, find some safety or resources on how to get some treatment, or resources on how to get away from the, shows us who's falling victim to postpartum depression, and it helps us to recognize that and to see what area of trouble they're having it on, because they're not all depressed the same way.
Some questions, they're not true and they're not honest with you. So this makes it easier for us to get an accurate answer, and for the patient not to feel like we are questioning them and pressuring them into like an answer. So that makes it a lot easier, as well as they might not want to voice partner violence to someone that they don't trust. So this just gives them alone time. We can leave it in the room and let the patient fill it out, and that way we get true answers.
That has been a little frustrating is sometimes if there is an abnormal finding, the MA won't alert the provider, and so then you don't actually realize that there is an abnormal finding until you're charting on the patient after the patient's left. Mm-hmm. And so that is something that probably slips through the cracks occasionally, but we do catch it when we're charting and then make the appropriate follow-up.
Really important to give that woman her time to be able to complete that and not feel pressured, and also to have the space to do it, and for you to come across as having that trusting relationship with the patient. Because if I were in an abusive relationship, and we'll just use the IPV screening, the HIT screening for an example, but if I was in an abusive relationship and my partner was here, even if you ask him to wait in the waiting room, I might be really nervous about that, and then worry that he's gonna walk in the door any minute before I can get it done and get it out of the way. So making sure that those screens are taken out of the room. That way, if there's older children that can read, or friends, family, something like that they wouldn't want, because even intention of pregnancy, they might have intended to get pregnant, but maybe their partner didn't really want kids. So I think it's important to focus on the privacy of those patients.
Yeah, every woman that fills out a risk screen at least has to ask herself those questions, and then make the decisions for what box to check, and then we can help her beyond that. Otherwise, I don't know if the subject would even come up if we weren't doing the screenings, and they would be ashamed, maybe to ask for some help. But this way we can get the information and give them the help they need.